Welcome to Miskawaan Health Group retreat on the tropical island of Koh Samui here in Thailand. I'm David Boehm. I'm the CEO and co-founder of Miskawaan Health Group. And today we're going to talk about a topic which is quite sensitive, in fact, probably very sensitive to most, if not all of us, and that's the topic of dementia and Alzheimer's. So I should start by saying that I'm not a medical doctor, I'm not a scientist, I'm a business person. However, all of our clinics here in Koh Samui, in Bangkok, in Ludwigsburg, in Germany, in Vienna, in Austria, and in Hong Kong are licensed medical clinics staffed by licensed medical professionals. So we are professional, and we like to always say that everything we do is for the benefit of your health. So I mentioned dementia as a very personal topic because probably all of us have someone in our family circle or in our circle of friends that is impacted by dementia. The brain is an incredible organ in our body. We don't fully understand it yet, and we don't fully understand the reasons why people are suffering from dementia. Alzheimer's, as you probably know, is the largest category of dementia. It probably accounts for more than 50% of all dementia sufferers. But we still really don't know exactly why certain people are suffering from dementia and certain people are not. And we'll talk a little bit about the factors that can contribute to dementia today. But first of all, I'd like to talk about the diagnoses. So I think one of the problems with modern medicine, and it's not really anybody's fault because it's happening on behalf of both the patients and the doctors, is misdiagnosis. So if someone goes to see a doctor with a serious condition, they're going to want to have a diagnosis. And that's understandable. We all want to know what's wrong with us. And when the doctor is given a set of facts, a set of circumstances, since the patient is going to want the diagnosis, the doctor's going to want to give them a diagnosis. So we have this system that's geared up to giving a diagnosis. The problem is that things aren't always very clear-cut. And some people who may present with certain types of conditions, which may, under a textbook definition, appear to be one kind of ailment or disease, it'll be quite different for other people who have a similar set of circumstances and maybe a similar set of symptoms who may have a different kind of condition. So it's very difficult to put one individual into a box and say, okay, this individual has dementia, or this individual has Parkinson's disease, or this individual has Alzheimer's. So I think one of the things that's very important when we talk about these sensitive subjects like dementia is to just bear in mind that there won't necessarily be an exact diagnosis for a particular condition for a certain person, and there may be a combination of factors that can cause the condition that the person presents to the doctor in. So I would always say to you that if you're dealing with a serious ailment, if you're dealing with a serious disease, by all means, see your regular doctor, see your family practitioner, take their advice. The one thing that we may want to do is that you might want to seek a second opinion, and perhaps seek a second opinion from an organization such as ours, which is dealing with functional medicine, the way of treating the body in a more natural way. And as my co-founder, Dr. Johannes Wessolly, always says, the best doctor is your own body. So if we can balance your body, keep your immune system calm and stable, then pretty much everything that's going to come your way in terms of disease can be handled by your own body. And one of the things we've talked about a lot is inflammation in the body, and chronic inflammation in particular. And our doctors and scientists say that every serious disease, every serious ailment, the first step towards that condition is going to be inflammation in the body. So one of the things we want to be very careful about when we're getting older and we're worried about perhaps dementia or Alzheimer's or some other serious condition, neurological condition, we want to reduce the inflammation in the body. And we talked about that before in our video series, but it's very important as a step to consider avoiding dementia is to make sure that your body is calm and balanced and does not have inflammation. Another part of your body which can cause issues leading up to dementia, and again, we're not talking scientifically here, we're just talking anecdotally about the things that our doctors have observed over the years. Dr. Wessolly's been practicing for more than 30 years. our doctors in Thailand for many, many years as well. So another very important part of keeping yourself healthy and avoiding things like dementia is your gut. And we talk about the gut all the time, the gut microbiome. Make sure your gut microbiome is always healthy and strong, that you've got some good probiotics that you're taking, especially if you've had to take some antibiotics for various reasons. It's really critical because we're calling the gut microbiome our second brain. And we've talked about for many, many years, people say, well, I've got a gut feeling. Well, actually, that gut feeling can actually be something significant because we do now think, most scientists and medical professionals think about the gut as the second brain. Another very important part of your body when we talk about avoiding dementia, and that's what we mainly like to talk about today, is the avoidance of serious ailments like dementia, is the mitochondria. Basically, we rely on the mitochondria to give our cells energy. And mitochondria can be damaged by the environment, by various chemicals, toxins, pollutants that are in the environment that we're consuming through food and whatever. And so we have to be careful to make sure our mitochondria is doing well, because if it doesn't do well, we're going to lose energy, and that also, poor mitochondria can lead to serious ailments like dementia. Mitochondria is something we're really focused on here at Miskawaan Health Group. We have ways of testing the mitochondria, and we have ways of improving the mitochondria, getting rid of the old bad mitochondria and introducing new mitochondria to your body, which is going to help your energy levels, and you'll feel better anyway. Another test that we do for all of our clients is a heavy metal toxification test. And unfortunately, living in this modern world, heavy metals are going to be a part of our life. If we love eating ocean fish, you're likely to have mercury. If you're been vaccinated like normal people, nearly all vaccines, if not all vaccines, contain aluminium. There's lots of sources of aluminium that we can get from eating as well. So pretty much every single person who lives in a city that we've tested for heavy metal toxification has tested positive for things like aluminium and mercury. And it's been shown that in humans, heavy metal contamination will quite often lead to conditions such as dementia and Alzheimer's, Parkinson's disease. So we have methods that we use to reduce the heavy metal toxification in your body, things like chelation therapy, which is done through infusions. And it takes a while. In my case, when I first went to see Dr. Wessolly, my wife and I had quite significant levels of mercury, and it took around 6 to 9 months to actually get rid of that mercury in the body. And we still take supplements to reduce heavy metals in the body because we are still consuming products that contain heavy metals, and that's just part of life. You can't really avoid that at all. It's also very important to look at micronutrients, and something that I take religiously every day is a coenzyme Q10. It's very good for your brain health, and I feel that it's a very beneficial supplement for everyone to consider taking. Vitamin B12 is also very beneficial as well. So what I'm trying to say to you today is that we would like to help you to avoid a serious condition like dementia, and we'd like to help you to avoid that through the various mechanisms that we have in our clinics, some of the things that I've mentioned here today. And most importantly, if there is a diagnosis of some serious condition like dementia, like Alzheimer's, perhaps come and talk to us about that diagnosis, because we have had cases where people have presented to the clinic with Alzheimer's and they've gone home without Alzheimer's, and we didn't cure Alzheimer's, but what happened was there was a misdiagnosis and the actual treatment they'd been given was quite harmful to their health. And we correctly analysed the person, changed the diagnosis, and often there isn't just a simple diagnosis, it could just be one of a multitude of things, but by spending a little bit more time and finding out exactly what's been happening with that person, we find that we can do a more accurate diagnosis for that individual. And we are always about individual medicine. Thank you very much for spending this time with us today. We have a number of videos that are available to all of you to look at various topics on health and wellness and fitness. And we thank you for spending the time with us, and we look forward to seeing you again soon at the Miskawaan Health Group retreat on Koh Samui here in Thailand.